department yesterday, there are 0 new cases in hotel quarantine. The 2 cases have been in ISO. They are close contacts of that Coburg cluster, and it was obviously late in their 14-day period that they've tested positive. They have been actually in hotel ISO because of their household circumstances. They had sought to isolate away from other family members, as many people have done, so they pose no risk to public health more broadly. We wish them well, of course, and I'll take this opportunity to thank the many thousands of people who, over these last few weeks, have been at home, isolating away from other members of the community. We thank them and we acknowledge the fact that whilst we've all pretty well got back to normal in these last couple of weeks, they have been doing the best of work for all of us, not only to keep their own family safe, but to keep every single family safe. So we thank them and absolutely acknowledge the sacrifice and the important contribution that they have made to protecting public health. It does speak to the fact that this UK strain, you can very late in that 14-day period become positive, and it also speaks to why it's so important to have that full 14-day ISO period because of the fact that even the last few days can be very meaningful when it comes to infectivity and positive test results. Speaking of test results, there were 16,594 results received since yesterday. We thank each and every one of those, going on for 17,000 people. This is just the absolute key. If you've got any symptoms, get tested quickly, and that helps all of us protect you, your loved ones, and every single Victorian. It's how we track and trace, it's how we keep pace with this virus, or indeed try and get a step ahead of it. That brings to 4,942,705 the total number of test results that we've received since the beginning of the pandemic. Just on vaccines, before I go to restriction changes and some very good news for all Victorians, 839 COVID-19 vaccinations were administered yesterday through our health services. That's the part of the program that we're responsible for, as opposed to the balance, which is the federal government's program. That brings to a total of 2,902 the total number of people that have been vaccinated since the beginning of the week. We're going to continue to report that data in as real time as we possibly can, so that people have got a sense of the progress we're making. I will just stress, though, this is being done in a slow and steady way. Safety first. This is a precious commodity. There's limited supplies of this, and therefore we need to be very much focused on not wasting any and doing this properly. So those numbers will build, but we are well on track, I think, to meet all of the requirements that we've signed up to. I've taken you through those 2 new cases and their circumstances. Brett may want to add to that later on if there's any further questions about that. I now want to talk directly to the changes that we can make as a result of having brought this outbreak, these different clusters in this outbreak under control, as a result of the patience and the commitment of the Victorian community to that short, sharp circuit breaker, which has worked, and the fact that so many people, those ones I referenced earlier, who are staying at home and isolating away from others, I can confirm that we will, from 11:59 p.m. tonight, based on the advice of the Chief Health Officer, return to our COVID-safe summer settings. Not New Year's Eve, but the settings that were in place at Christmas time before we had those cases come to Victoria from Sydney. So before that Sydney outbreak was extended to Melbourne, and we had Black Rock and that cluster, which I'm sure people can well and truly remember, we had those COVID-safe summer settings. We locked them in, and we can, from midnight tonight, return to those settings. That's a testament to the fact that Victorians have proven, as stubborn as this virus, we've proven ourselves, all of us, in the sacrifices we've made, the decisions we've made, and the conduct that we've exhibited equal to this task. This is by no means over. There's a lot to go. We've got to get everybody vaccinated. That's going to take months and months. There's no alternative to that. But it is an absolute testament to the conviction and the character of the Victorian community that we can make these decisions tonight, effective from midnight tonight. So, masks will only be required in high-risk settings, including public transport, rideshare and taxi vehicles, large retail settings such as shopping centres, supermarkets, department stores, indoor markets. I think people are well and truly familiar with those protocols and those rules as they applied prior to New Year's Eve. Up to 30 people can attend a home per day for private gatherings, up from the 5 that is in place now, and the 15 that was in place from New Year's Eve, so back to 30 to your home per day. Up to 100 people at outdoor gatherings. For the first time, can I say this is a very important announcement, for the first time we will, from midnight tonight, so most likely from first thing Monday, we will be able to have 75% of both public and private sector workers back to the office. That is very important in terms of retail trade, hospitality, food and beverage, that whole part of the economy, and not just for the CBD, as important as that is, but in lots of different suburban locations as well, regional centres. The 75% from midnight tonight, in real terms from Monday, to the office, both public and private sector. You would recall that we were on the cusp of moving to that setting when we had our most recent challenges. So I'm very pleased, again, based on public health advice from the Chief Health Officer, we're able to make those adjustments as well. Restrictions on the number of visits to hospitals and aged care facilities will also come off. Having said that though, individual hospitals may have, for certain parts of the hospital, for instance where patients are immunocompromised, ICUs and things, cancer wards, things of that nature, they may have localised rules, but those statewide rules that we had put in place, they come off from 11:59 tonight. I'm also very pleased to be able to confirm, I'm sure you've seen reports from the AFL, that we will move to 50% capacity at the MCG. That's obviously 50,000 people, just under 29,000 people at Marvel Stadium. We will soon have announcements to make in relation to GMHBA Stadium. There's just some final work being done on that to get that number to the highest level that is safe. That's great news as the footy season, the AFL footy season, is obviously starting quite soon. That'll be something approaching normal, which is something that Victorians have absolutely earned. Again, can I just extend my thanks to each and every Victorian for the way in which they've conducted themselves, the way in which they have followed the rules, followed the advice, been guided just as I am and my team is by the science, by the doctors. That's what's delivered this outcome, both a short, sharp circuit breaker being effective in bringing control and that sense of certainty to those cases. As widely infectious as this virus is, that strategy worked. What's more, waiting this little bit of extra time so that all those cases that were connected to that outbreak could see through their 14 days, that served us very well, and it's with confidence that we can return to those COVID-safe summer settings. But none of it's possible. None of it is possible without the extraordinary efforts of every single Victorian, and I'm deeply grateful to each and every one of you. I now might ask Jerome just to add to my comments, and then we're happy to take any and all questions you have.
Thank you, Premier, and good morning. Over the last few weeks of what we call the holiday outbreak, collectively with thousands of Victorians, we've delivered a strong and swift response to this significant outbreak. We've managed over 3,500 primary close contacts at the peak of this particular outbreak, 99% of whom were contacted within the 48-hour national benchmark standard, and of course, as we've discussed many times before, in the vast majority of times far quicker than that. We've listed over the course of this outbreak dozens of Tier 1 exposure sites. I'm pleased to confirm that those Tier 1 exposure sites have now been formally closed. We still have one outstanding Tier 3 exposure site, the Servo in East Bentley, which we are not excessively concerned about, but we would ask anybody who was at the Coles Express Servo back on the 18th of February between 1 o'clock in the afternoon and 1:40. If you haven't come forward yet, please come forward immediately, get tested and isolate, and we will work with you. It is those kind of actions, it is all those people coming forward from those exposure sites, it is all those people who have been on the QR code systems over the course of this outbreak that has enabled us to get hold of those people so quickly and to ensure they get tested, they isolate, and now, of course, the vast majority of those people are coming off their isolation period. We're very grateful to them for their support. We'd also like to thank all the retailers and all the businesses that have been supporting us over the last few weeks. Their record keeping, their swiftness of response and their support has been instrumental in making sure we run this outbreak to ground so quickly, and that we've managed to contain all of the positive cases to those initially established primary close contacts as this outbreak emerged in the early days. Of course, we're continuing to work with our primary close contacts to ensure that we clear them properly. Those conversations and those calls and those letters are all ongoing. The vast majority of those have been done. We will continue those over the next few days, and my thanks to everybody for their patience in that particular process. It really has been a work of hundreds of people in our contact tracing operations, in our testing operations, that have supported thousands of people who have had to isolate over the course of this outbreak, and of course the over 382,000 people who have gone and got tested over the course of this outbreak since the 7th of February. And my thanks to the huge numbers of people who've done just that. Your testing support and your willingness to come forward has enabled us to really quickly understand the scale of this outbreak, to ensure we establish the correct primary close contact field, and to support those people to isolate, and to enable therefore the restrictions to come off not only 10 days ago, but of course again tonight. And that also means, I think this is now really an example of how we deal with this really complex, higher risk UK variant outbreak, and it's obviously a huge reward to Victorians that we've managed to contain this one and bring it back to zero and get us into a better place. With regard to testing, we need to of course continue our vigilance around any future outbreak of community transmission of COVID in our community, of any variant. That is why our testing system continues to run. It's why our testing centres continue to be available, many of them continuing to run with extended hours. 16,594 people came and got tested yesterday. We're really grateful to them, and we need to continue to see people get tested when they have the slightest symptoms, no matter where they are in Victoria. Every single outbreak we've had to deal with over the last 4 or 5 months has come because people have come forward and got tested because they're symptomatic. It is so important that people keep doing that, and we continue to keep this COVID-safe behaviours, particularly as we start to see the vaccination programme roll out. But that, of course, is the work of many, many months ahead, and we all have to work together over that period of time to get beyond this COVID pandemic. With that, I'll hand back to the Premier for any questions.
Can I just go to the issue of why midnight tonight? We had indicated all along that it would be 11:59 p.m. tonight. I just want to assure people that if we could do it earlier, then we would, but there are a whole range of legal processes, assessments, drafting that has to be done. I know it seems probably quite a simple process, but it isn't, and that's why 11:59 p.m. Despite, I know, just if you guys are any guide, I'm sure people would have much preferred it to be earlier, but you've got to do these things properly, and that's exactly what we will do. So it is from 11:59 p.m. tonight, and that is great news, and a real credit to every single Victorian. Can I just finally, having thanked all Victorians, can I just again pay a special mention to all of those people who've been at home. While we've got back to something close to normal, they've been isolating for us, for all of us at home. We're very grateful to them. And the other point to make is that to all of our team, whether it be people in testing sites, people working in path labs, people doing contact tracing and all that work, we're all grateful to them for having done an outstanding job as well. We're happy to take any questions you've got.
A lot of major events outside footy, was the footy be able to have 50% capacity? Some company footy.
Sure. There's a well understood process, and it's literally working, 7 days a week to process events large and small. And to your point, Richard, how many people are at the G is very important, but it's not the only issue. It's a lot of other activity, whether it be concerts at Hanging Rock or farmers markets or country footy or whatever it might be. Lots of different events across the state, and we have a graduated framework to make sure that we've got specific focus on the risks posed by each of those events, their circumstances, how those risks can be managed, and that kind of bespoke approval framework, hopefully in good time, well before, whether it be footy or any other milestone, well before things begin, from a season point of view, for instance, we're able to give people the clarity that they need. If there's any further information I can get you on any other events, if they can be grouped into classes of events, if you like, say like country footy as you cited, I'm sure I can get Martin Pakula to come back to you on that.
Will masks have to be worn at high schools?
The rules don't change in relation to school, but again, it's high risk where you can't distance, and we deem that in the main to be when you're going to the supermarket, when you're on the train or tram or bus, when you're at a large shopping centre. Schools have had their own approach often when it comes to masks, but again, there's no requirement per se. That would be dealt for students. That would be dealt with on a school-by-school basis, and we've been in constant discussions with them, both from our sector but also from the Catholic and Independent sector.
With the workforce now going back to 75%, do you expect people to take that up as from Monday, or do you think a lot of schools stay at home?
Look, I've tried to be as frank and as honest as I can be with everybody for months and months now on this very issue. I hope, and we'll do everything we can to see the CBD and suburban CBD, I suppose, equivalents, regional centres, as vibrant as possible. That's what we want, absolutely. What I've tried to be pretty frank with people, in my view, is that there are a number of people who, having spent a lot of time working in a different way, a percentage of them are going to want to continue to do that. Not every worker for every day, but there will be people for whom that works. And whether it's the ability to do an early morning meeting from home, then take the kids to school, then be back and do a day's worth of meetings, calls, Zooms, all that sort of stuff, for some people that works. Not necessarily 5 days a week, but I think we would be unwise to assume that everything's just going to snap back to normal and 100% of people are going to be at their desk again as they were in, October, November 2019. I think that this whole concept of a new normal is very, very real. So it's good. It's a great day to be able to get to 75%, and workers and their bosses will work through all those issues. But I'm not necessarily certain that we're going to see on moment one, on day one, we've got 75% of people and people urging me to go to 100%. I think it may take some time, and indeed there may be some people who don't come back to work the way they used to. That's the nature of change.
From the new cases that were today's tally,
Yes.
can we get some details around like day 11 cases that have been positive?
I might ask the Chief Health. They were day 11 tests. They've been, I won't name the hotel, but they've been in hotel ISO at their own request, because we won't go into the details, but their household, whether it was a vulnerable member of the household or others who were workers, whatever it might be, that wasn't the best environment for them, so they asked to be put up. That's exactly what we did, so now we can have absolute confidence. And I'd also say we've had a record compliance effort, lots of phone calls, lots of text messages, lots of home visits for all of those people who've been isolating at home, and the response has been absolutely magnificent. People have been doing what we had asked them to do, but we can have absolute certainty about these two people because they were in a hotel doing their ISO at their request. So we wish them well, but it does speak directly to the fact that you can get positives popping up very late, very deep into that 14-day period, which is why it's 14 days and not 8 days or 6 days or 10 days. It needs to be 14, that's the standard, and that comes into its own when you're talking about a much more infectious strain, the UK strain.
Can you give us an assurance that you won't go back in any snap lockdowns in the future?
I can assure you that we'll work as hard as we possibly can to avoid that. That's always been our approach, but I can't rule out, if I get public health advice, then I follow public health advice. But, we've got every reason to be confident, we've got every reason to be optimistic, having returning now to these COVID-safe summer settings, the Christmas settings, not the New Year settings after the Sydney cases, but we all have to remain vigilant. And I know, look, I've said this a lot, but I am going to say it again because it's important. We all want this to be over, desperately, but it's not, and we can't pretend that it is. And the vaccine's being rolled out, that's going to take some time. It's one of the biggest logistics tasks our country has ever seen. If you could just vaccinate everybody, in a week, well, fine, you would, but that's not the nature of this. So we're going to need rules, we're going to need vigilance, we're going to need an acceptance that it's not normal, it's COVID normal, and we're working as hard as we possibly can, and we'll continue to avoid any more restrictions than are absolutely necessary. And if we weren't confident to make these decisions today, then Cabinet wouldn't have endorsed them this morning, and the Chief Health Officer wouldn't have provided his advice this morning that we should.
Premier, speaking of vaccine, did the Commonwealth of the state refrozen vials?
Rich, I've seen those reports in the media today. I couldn't confirm that. I think probably Greg Hunt is the person to talk to there. We, as I said before, given that it's almost lunchtime, we will have pushed through the 3,000 mark by now. Well and truly, I would think. We're doing this in a very deliberate way, a very slow and steady way, and I know that 3,000 in the best of 4 days doesn't seem a lot, but it's a precious thing. We need to be very careful, safety first, all of those things. So we're quite pleased with the start that we've made. We don't underestimate our task, though. I'm sure the Commonwealth doesn't either. But as to this notion of there being about 100 extra doses from a particular aged care facility, and then them being, well, I suppose you might say, mishandled and therefore not being able to be used. I've seen the reports of that. I can't confirm that, but Greg Hunt would be able to.
Brett or Minister Foley, any more light?
Can you shed any more light on that? The collective, no. I think I haven't got his number, but Greg Hunt's the guy to talk to.
Victoria's given 13,000. Victoria's given 13,000
Yes.
vaccinations. You've done around 3,000
Yep.
today. Are we behind schedule?
No, I think we're going along as we had thought. You've got to get the systems in place, and let's be clear, this is from basically a standing start, so you've just got to build up, and I think you'll see in the days ahead, we're only on, that data only reflects Monday, Tuesday, Wednesday and Thursday, and in fact the numbers went up slightly between the brief I got very early this morning and the brief I got just before I came out here. So we're being as transparent as we possibly can be. We are giving you those numbers every single day. I'd encourage others to do that too. That's an important part of this. I don't know whether others are. We certainly are. We made a conscious decision to have those numbers out there. I think it's on track. I think it's going as well as it could be going for something that's just brand new and only four days old. But those numbers will tick up over time, and we're on track to meet the obligations we have and the agreement that we've entered into with the Commonwealth as part of their Commonwealth government rollout.
To stay on that track though, you need to get the extra 10,000 jabs rolled out by Sunday.
No, we're doing this in a very steady, safe way, and that means it can't be quick. It's got to be done in a painstaking way. It's got to be done in an absolutely methodical way. And I'm not sure what other states have done. They're not necessarily reporting those numbers. I don't know what the Commonwealth's done. They're not reporting those numbers either, it would seem. You might want to speak to them, but we are, again, it's not being boastful, just in case any of you decide to write that headline. It's a big job. We've made a good, strong start, and we're committed to getting it finished, and we will. And we're reporting to you every day the progress we make, and I think you will see those numbers tick up, and we will fully deliver on the commitments that we've made.
How much do we owe New South Wales quarantine bills that I imagine they're going to pay?
Yeah, I'm not entirely certain. That's a matter that Tim and Dominic are working on, I think. So I'm happy to get Tim Pallas to come back to you on that.
You won't rip up the bill like
No, as I said, they're working together. If that was the case, I don't think they would be working together, would they? I think Dominic Perrottet would have a dim view of that. We are working, and again, it's not Gladys and I, it's the two treasurers who are working together on that, and I'm confident that that matter will get progressed. If I can get you an update via the treasurer, I'm more than happy to do that.
Do you think with the easing restrictions that get more flights now?
Yeah, look, I had a meeting with Alan Joyce a couple of days ago now, on Wednesday I think, and we talked about, what is needed in a national sense for them to have greater certainty. And I gave him an absolute commitment. There were 3 or 4 issues he raised, and I've given him a commitment on each of those that I would be supportive of a framework. We can't, to your earlier question, there's a whole bunch of stuff we can't rule out. If I get advice to not allow people to travel back because there's been an outbreak somewhere else in the country, I think Victorians would want me to follow that advice. We're all working, I know we are, and I'm confident other states would be too, we're all working as hard as we can not to have those outbreaks. I hope that both the 75% of the office, the easing of these restrictions, the fact that this outbreak has been well managed and run to ground by thousands of staff who work around the clock, hopefully that means there will be more flights, Dennis, but there's some broader issues there, and we work very closely with Qantas on those. As recently as Wednesday this week, some very detailed discussions about some things that Qantas need in order to put more planes in the sky. And in the event that people do get locked out for the best of reasons, additional services can be put on to get them home in whatever window we can give them.
The restrictions say it is until everyone's vaccinated.
No, I wouldn't say that. We've not necessarily got a hard and fast schedule or an alignment, Bridget, between as we get more and more people with the jab, can we ease off some of the restrictions? Work's being done on that now, and in fact, to a certain extent, the work that Phil Gaetjens and other First Secretaries are doing, which was a result of the last National Cabinet meeting, to try and find, well, what are the parameters for kind of COVID normal as the vaccine is rolled out? So case numbers have driven us. Is that still a useful and fit for purpose way of measuring whether we're doing well or not? All that work is being done, and hopefully we can have a nationally consistent approach to that. But it just stands to reason, as you get your frontline workforce, as they move through the vaccination program, as the most vulnerable people, those who, if they got it, there's a very high likelihood they would become gravely ill once they get the jab, then perhaps some settings can change. Perhaps we have a greater, the risk is deemed lower, and there are more things we can do. That isn't for today. But there's certainly work going on. It's a very good question, because we are doing that work now, and when we're in a position to kind of forecast that, we will. But my hope and my expectation would be that will probably finish up a national thing, which is exactly the way that it should be.
Speaking of the vaccination program, given the issues we've already seen in the first week on the Commonwealth side, would you prefer if the state just ran the entire program in Victoria?
Well, we've got an agreement with the Commonwealth. If the Commonwealth want to come to us and say, we'd like you to do it, well then, we're always open to that. But again, I'm not here to be a commentator on the Commonwealth program. I've been very clear about that. I was sort of invited to reflect on it, and I'm not doing that. I think Greg Hunt's the person you should speak to on those issues. I'm not for a moment in any way underestimating how big a task we've already got. We've got a significant body of work to do. We're absolutely focused on doing that. If the Commonwealth want further assistance, if the Commonwealth want to kind of renegotiate what everyone's doing and how it's being done, well, in my experience, Mark, they would come forward and they would ask. They've not done that. They've not done that yet.
Premier, Healthcare Australia has been in the news this week. I've got a new CEO. They also play a role in our quarantine hotels.
They do.
Are you comfortable with that, or is your government reviewing their role in our hotels?
No, I've got no advice that suggests anything other than, yes, they perform a number of different functions for us, and they perform those to the highest standards. That's the advice I have. If that advice was to change, then of course I would update you on that, and we would talk about that openly. But that's not the advice I have. My advice is that they're doing a good job for us in very different roles to the ones that they have been in the news this week. And I'm very pleased to think that those two senior citizens, those two aged care residents, and on the reports I've seen to date, are going well after what happened. They're a significant company. The work they do for us is done to a high standard. That's what I'm told. That's the advice I have. If that was to change, then I would share that with you. Yeah, look, to be honest, I want an Anzac Day parade. I want to commemorate those who have given everything for us and those who serve this very day in the defence of the things that we hold dear. One of the great honours and privileges of this job, and until you've done it, you don't know how emotional and how significant it is, but to lead that march is an amazing privilege, one that I cherish every year. To be at the dawn service and to be in the official party at the dawn service is a deeply emotional and profound thing. I want an Anzac Day that is as close to normal as possible, and that's why we're continuing to work with Anzac House and with other groups, our partners, to try and get that. I would just say it is a little way off. We do have a bit of time, and I genuinely would hope that no one questioned the commitment from me and my team to work with our ex-service organisations to get an Anzac Day that is much closer to a normal Anzac Day than what last year was.
Where are we on international?
Yeah, I'm not in a position to yet announce when we'll have flights return. When I am in a position to make that announcement, I will.
Based on our current trajectory there, back to vaccines, when do you think we will get through those 13,000 in Victoria?
I'm not entirely sure. I might ask the Minister, might be able to. He's been patiently waiting for an opportunity to say something, so there you go.
So as you know, we've set up Western Health, Austin Health, Monash and Barwon this week. I'm pleased to see that further hubs in the region will kick in on Monday, and then the final ones the week after. As we've indicated, because of the important, precious nature of the allocation of the Pfizer vaccine that's been made available to us by the Commonwealth, we are making sure our systems and our processes are steady, safe, and then we will exponentially grow them. And I'm quite confident that the 30,000+ targets allocation that we've been given in the initial phase 1A trial will be met as we hit the full 9 hubs over the next week or two, especially given that it's a hub and spoke system, that as we've seen, for instance, Western Health establish a hub at the airport, that we've seen Monash Health partner with Alfred Health to establish hubs at the hotel quarantine system. And you'll see increasing levels of this system of hubs and spokes make sure that this very precious vaccine we've got is cherished and is got into the arms of Victorians as quickly and as safely as we possibly can.
So the 13,000 we have at the moment, when do you think we'll have all of those?
As per the schedule that the Commonwealth and us have agreed to over the course of the next 3 weeks.
How long, sorry?
Over the course of the next 3 weeks.
Moving forward, obviously, the vaccine rollout, will you be able to take 2-week blocks when it comes to restrictions? When's the next milestone for us?
No, as the Premier said, it's an ongoing evaluation process. It hasn't been locked down in terms of particular milestones over particular timeframes, but clearly the greater the vaccination coverage, especially for those most at-risk populations and for those most at risk of exposure, so our frontline healthcare workers, the quarantine and port of entry workers, when the coverage of those populations and the elderly and those with chronic illness, the high coverage in those populations would give me, as for everyone in Australia, greater confidence that we can go to freer settings, but we're not at a point where they're locked in terms of specific detail.
And do you think we'll see more of those day 11 positive tests? I know you don't think more, but is it likely to see that?
There's not that many left to run. Clearly, a lot of individuals have already completed their quarantine period, the incubation period of 14 days as primary close contacts. We're really closing off those last few dozen over the next few days. So it's possible, and we need to re-emphasise the issue that anyone who hasn't completed their quarantine period could become a case, needs to remain quarantined for that full period. But I'm not sure we'll see any more. It's not out of the question.
Do you feel more optimistic now than in the past we're now in COVID normal, so to speak, will stay that way? Do you feel it's a better position?
Yeah, we've been building in confidence as time goes by, and clearly the vaccine rollout is another step in that direction. Getting on top of these clusters in recent weeks and seeing how that's been done rapidly and robustly, that's all confidence building. It's certainly the case that a few thousand vaccines do not herd immunity make. We need really high coverage for the vaccine, which will take some months to get there.
UK strains are moving so rapidly with contract tracing. What does it tell us that people testing so late?
There's still a possibility that anyone can test positive, anyone can become symptomatic right through that 14-day period. We have to be alive and alert to that possibility. The new variants of concern that are emerging need a really robust response. You need to get to those primary and secondary close contacts because of that infectiousness. The fact that household members are testing positive, are becoming symptomatic as those primary close contacts are testing positive is a concern. But we know the process of having 3 rings of control is really critical. But you don't want to see community transmission, widespread community transmission with any variant of concern, which is really any virus going forward. They've really become the predominant variants across the world, and new ones will emerge, and they will bring new challenges in terms of disease severity or infectiousness, or indeed challenges to the vaccines that are in production.
But is the working assumption that these cases may have been a lot later in the piece than the last few days?
We're dealing with small numbers, so clearly we've identified a few on day 11. But where people haven't developed symptoms, it may well be that they would have tested positive much earlier in the piece after the day 3 test. But we pick them up now. We go through a process of doing that day 11 testing, and we're required day 14 testing to make sure we pick them up, because you can be pre-symptomatic, you can be asymptomatic and still pass it on.
The specifics of some of the restrictions. In New South Wales, they're doing 50 people in their house, but nightclubs are still closed. You get 30 people in the house, so one person per 2 square metres. So you could be in the nightclub with 100 grand and just about 30 people in the home. How does that work?
Yeah, look, it's not a race with other jurisdictions, and they'll each come to their points of determination around limits as they see fit. The advice of my public health team is that these are settings that are appropriate. You go to more liberal settings, you carry a greater risk. There are some specific settings that we know are higher risk, and we've placed greater controls on them. That applies to gyms and some other indoor settings where, clearly masks are required. So those are the settings that we've determined based on our assessments of public health risk. I'm not going to comment on other jurisdictions' decisions in that regard.
Just on, again, as the Chief Health Officer said, it's not a matter of, well, people are free to make comparisons if they want, but that doesn't really come into our thinking. And whilst I would defer to far superior knowledge of nightclub environments, you clearly have a much greater understanding of that than I do, which is not a bad thing, probably a good thing actually. That's a regulated environment, right? It's clean to a certain standard. We've had this discussion a bit. Why can I have a party of 10 or 20? Why can the restaurant be open, but I can't have a big barbecue at home? Well, we know that your home, every home, is a much higher risk environment for all those reasons. QR codes, keeping your distance, cleaning to that highest of standards. All the formality that comes from a venue that isn't your home decreases the risk. So that would be my answer to why I think comparisons are not necessarily helpful. There's a broader principle here.
The crux is maybe that we're clearly being quite conservative on this home gatherings, keeping it 30 for now. I'm just trying to understand the logic versus when you can,
Sure. Well, I think I'll probably explain the logic. And whether we're conservative or otherwise, I think Victorians have been through a lot. And, if I got advice that 50 was a safe number, then it would go to 50. And that may be the case in a few weeks or months' time. I can't really predict that. More likely months than weeks, I would think. But homes are high risk. I know that's a bit counterintuitive because you're with people you know and all that, but that's exactly the issue. You don't keep the 1.5 metre distance. You don't necessarily have all the formality that comes in a restaurant or a bar or a cafe. And we'll follow advice, and if that's deemed to be conservative by some, I think frankly having 30 people at your house over the course of a day, and not instead of 50, is a small price to pay to have the place open and to be able to make these decisions that we've made today effective from midnight tonight. 75% of workers can go back to the office, public and private sector. We won't be wearing masks the way that we have been. We'll go back to those pre-New Year's Eve settings, the Christmas settings. I think that's a really positive day and one that every Victorian can be proud of because they're the ones that have actually built this.
Where do protests and public demonstrations fall under these new rules?
Well, there's a gathering limit of 100. In terms of protests, I would just say to people, there are times to protest, and I don't make any reflections on what people are protesting for or against. That's not for me to do. That's the nature of protest. There's nothing unhealthy about that in a democratic state, but it's not 2021, like it was 2019. We're still in the midst of a global pandemic, and I just ask everybody, with everything they do, whether it be protests or 1,000 other examples, let's all of us not do anything that might contribute to the spread of this virus, because it's not a good thing to get, right? Even if you're young and fit and healthy, this long COVID phenomenon where people are ill for a long, long period of time, plus the fact that you may be contributing to the spread of this to someone who's not young, fit and healthy, someone who has got underlying conditions, someone who's older, someone who might well die because of this. It's not over. It's still here with us. We're at the beginning of the end with the vaccine being rolled out, but none of us have the luxury of pretending that just because we desperately, desperately want it to be done, that the whole thing's done. it isn't. There's still many months of this to run. But the good news is, from midnight tonight, it'll be many months with settings that we know, that we embraced, that we built back before Christmas, and as a result of our collective action and the fact that we've stuck together and got this job done out of the most recent outbreak.
Premier, I don't know if you said before about college.
Yeah, I did, yeah.
It's not mandatory, but they have to sign a commitment to be vaccinated.
Yeah, I saw that. Look, I'd leave it to them. Sorry, I saw a report, and it wasn't quite as much detail as that. I think that they might not necessarily have answered the very direct, are they or aren't they going to mandate it? I can't speak for them. Look, I think we're going to finish up with lots of different settings where people may, because they, choose to, will more than encourage people to go and get the jab. What I can do from my point of view is indicate to everybody that I will be getting the vaccine. So will all my family, including my mum. I have many people approach me. Lots of people from every walk of life talk to me about the vaccine. It's very, very topical. They talk about Pfizer, they talk about AstraZeneca, and my answer is consistent: get the vaccine. It's our way out of this, and we want everybody to do that. And you're not just doing it for yourself, though. That's the other point. You're doing it for every vulnerable person in your family and in families you've never ever met. It is absolutely critical. And whilst I haven't had mine yet, I'm letting frontline workers who are at a far greater risk of getting this than I am. They're going ahead of me, but I'll get it probably from my local GP, and I want everyone to do that. Everyone. But there will be different rules, whether it's getting on planes. Like, ultimately the federal government will have to deal with the issue of, do they let people in? Will they issue visas to someone who has not had the jab? All of those questions are to be answered over the coming weeks and months.
We're at sub 500 return travellers, and I think it's just in general in hotel quarantine. How much further is that going to be wound down? Do we understand when they're going to be exiting hotel quarantine?
I can try and get CQV to give you a breakdown of when their 14 days lapses. It's obviously based in terms of flight groups. I think the last group that came in was about 135, I think, on that particular plane. Let me get you an update. As soon as I can have more to say about when we can resume flights, we will. And we acknowledge and accept that is challenging for a number of people who are wanting to come home. But again, there are some bigger issues at play here, and the infectivity, the different challenge that this UK strain, these variants of concern pose and present to us. We've got our doctors looking at this very closely. What can we do differently in the context of these new strains to minimise the chances of this getting out? That's a process that I think every state's been through one way or the other. We're doing that. That's very important work, and I'm just not having flights land until I've had that work done. Not by me, it's not a political thing, it's done by experts in their field.
The tender that was put out this week for the new quarantine facility, why was that from the Department of Career and Cabinet and not by CQV, the Justice Department, if they're running quarantine?
CQV is an administrative office. I don't think it's unusual, but I'm happy to chase it up for you. I don't know why that would have been done. It would have been a decision that will, as I hope is clear, it's not a decision that I made. It'll be a decision that other public servants will have made. And look, it's a process that will be gone through, and I think there are some sites that have strengths, but whether it happens at one or other, or a third site, or a 15th site, that's to be determined. That'll be determined by others, not by me. We act on advice, and that'll be no different here.
Have you got a more crystallised idea of when you want it to actually be built by?
So what I want it to be,
When you want
when?
it to be built by?
Oh, look, I think that's all depends on where you go, funding models and stuff. Like, we haven't even settled yet the notion of, who actually pays for this. Are there contributions from the private sector? Are there contributions from our government? Are there contributions from, well, I suppose there will be contributions because people have to pay bills for those who are going through such a centre. All of that details to be worked through, and I want to assure you and everyone, that process is not run by premiers or ministers. It's run by senior bureaucrats, and it's run in an appropriate way. Any other issues? Very good. Thank you so much. Have a nice weekend. No, we must
Thank you.